What is up, guys? Welcome back to my channel. I am the house hacking mom, and today's video is going to be all about a bunch of different breastfeeding issues that you might be experiencing as a new breastfeeding mom. We're going to talk about cracked, sore nipples. We're going to talk about engorgement. We're going to talk about plugged ducts. We're going to talk about mastitis. We're going to cover all of those topics in detail, the signs of having those problems, the causes, as well as the treatments. And this is part 2 of this series that I have done all about breastfeeding issues. So if you have not seen that video, as soon as you finish watching this one, make sure you go back and watch my other video. So without further ado, let's jump right into the video. So first we're going to talk about having sore, cracked nipples. Now, you will hear people say that you should not be getting sore, cracked nipples if you are nursing properly, if your baby is latching properly, and that is more or less true. But first-time moms like me, we're pretty likely to have those issues because we don't really know what we're doing. So it's pretty likely to happen, unfortunately. So why do you get a sore, cracked nipple? Well, you know, tenderness and pain associated with nursing the first couple days is, in my opinion, pretty normal. And make sure you watch my video all about what to expect when you are breastfeeding as a first-time mom, because that's going to explain a lot about the different tenderness and pain that you probably will experience. But this specifically, we're talking about your nipple itself being super sore and cracked. What causes that pretty much is if you feel the inside of your own mouth, you will feel that the part of your palate right behind your upper teeth is very rough and rigid and hard. But if you go back on either side of your mouth, this part of your palate up here is actually pretty soft. And that's where you want your nipple to actually be inside the baby's mouth. You do not want your nipple to be up here because then it's gonna rub against that part of their palate and it's super uncomfortable, very painful. So make sure that when you are latching with your baby, you are getting the nipple all the way back here so that your nipple is only touching that softer part of the palate, and that will help tremendously with fixing your sore, cracked nipples. Now, if you have sore and cracked nipples, what you can do to make them feel a lot better, make sure you are using some Lanolin Cream. I will link my favorite one below. They actually usually give you some at the hospital, so that little tube that I got at the hospital lasted me plenty. So you might not need any in addition. You can also try using coconut oil. A lot of moms like that, but be aware that coconut oil does have a scent to it. So you'll just have to see if your baby likes or dislikes that scent. The other thing you should do probably anyway at the very beginning of breastfeeding is just pretty much do not wear a bra. Or if you are gonna wear a bra, wear a very minimal, no underwire type of bra. Basically, you want to get as much airflow to your nipples as possible. You don't want any fabric, especially any rough fabric, rubbing against it. You want to keep them as open as possible. And they should heal up pretty quickly. If your nipples start getting, ridiculously sore, they're just bleeding everywhere, make sure you get in touch with a lactation consultant so they can help you and make sure that you are latching properly so you can get rid of those sore, cracked nipples as fast as humanly possible. Now we're going to talk about having engorgement. Now, engorgement is a completely natural thing that should happen when your milk comes in after having your baby. And this usually happens after the colostrum is pretty much finished. The colostrum is that super thick yellow milk that you get the first couple days after having your baby. And then after that, you will get very engorged and your milk supply will actually start to come in. Now, I got very, very engorged. My breast tissue was literally coming all the way up to my neck pretty much. My breasts basically felt like bags of marbles. They were super tender, very tight, very hard, extremely uncomfortable. Now realize that engorgement is not just, oh my goodness, my breasts are just so full of milk. It's not like you literally have half a gallon of milk in each breast. What it really is a lot of inflammation of the tissue surrounding your milk ducts because it's not used to it, it's something different, they're having to work a lot harder than normal, so it just causes a lot of inflammation. So you can treat it in the same ways that you would treat any inflamed part of your body. You can put ice packs on it, you can massage it a little bit to help work out those knots and the really sore marble type lumps that you're gonna have in your breast. You can do it one of two ways. You can do a circular type motion just to really loosen up those areas that get super tight and very sore. The other thing you can do is kind of knit your fingers together like this, put it around your breast, and then just kind of do this and do it in a kneading type motion, and that helps as well. The most important thing with having an engorgement is try not to pump. You don't just want to pump to get rid of that extra pressure. because that can lead to having an oversupply and producing too much milk for your newborn. I have another video all about oversupply. Make sure you check that out. I will link it up here somewhere. So try your best not to do any extra pumping. The best thing you can do is just to nurse your baby as much as you possibly can and just compress that breast tissue so that they can get their mouth around it. You can also sort of draw that extra inflammation away from your nipple area to make the surface area around your nipple a little bit softer and easier for the baby to latch. So those are some things you can try when you are experiencing engorgement. The next thing we're going to talk about is having a blocked milk duct or a plugged milk duct. Now, pretty much the cause of this most of the time is that there is a milk duct that's not getting emptied and flushed out, either because, maybe you missed a feeding here or there, or your baby's not nursing at night like they used to. It can also happen if you're wearing a bra that is rubbing in a certain way against your breast. It can happen if you're wearing a baby carrier that does something that your breasts don't like. There's a host of reasons that can cause a plugged milk duct. Now, how do you know you have a plugged milk duct? It's basically going to be a very tender area. You will notice it will feel very different from the rest of your breast. It might have sort of a nodular, firmer, round, kind of marble type feeling to it. And that is because there's literally milk, thick milk that is kind of built up behind that plugged milk duct, kind of basically like a cyst or a pimple underneath your skin. Now, what you can do to fix your plugged milk duct is definitely to make sure that you are nursing a lot on that side without neglecting the other side too much, but make sure you are keeping that breast empty. When you are feeding, try to point the baby's chin towards the area that is sore, because where the baby's chin is will get the most suction and it can help to flush out that milk duct. Obviously, it's going to be tender to feed on that side, but you just need to fight through that and try to keep your breast as empty as possible. Other things you can do is try to massage it the same way that you are massaging with your engorgement. You can try to kind of push the milk out that way. You can also try laying your baby at a slight incline on their back and kind of breastfeeding over them so that you have gravity working in your favor and helping to drain your breast as best as possible. Now, a plugged milk duct can eventually lead to mastitis, and that's the next thing we're going to talk about. Now, there are some misconceptions around mastitis. Mastitis, number one, does not definitely mean that you have an infection. And number two, mastitis is not always caused by a plugged milk duct. It can also be caused by a cracked nipple and bacteria entering your breast that way. It can be caused again by the pinching of your bra or something uncomfortable around your breast. So there are other reasons that you can get mastitis. Now, what mastitis actually means, the itis at the end of that word basically means that you have some intense inflammation, which does sometimes come with an infection. So the standard treatment for mastitis usually is antibiotics, and you will get that from your physician. There's no way really to tell just by looking at somebody if they actually have a bacterial infection, but usually they will go ahead and give you the antibiotics just to be safe, and it's fine. It's not going to hurt the baby. And otherwise, you're going to treat it the same way you would treat a plugged milk duct. So you can try the massaging of the area, help to kind of flush the milk out, and then of course breastfeed on that side as much as possible. Now, heads up, nursing from a breast that has either mastitis or a plugged milk duct is going to be very, very uncomfortable. And there's really not much you can do about that. You really just need to fight through it, keep that breast empty, and it will resolve itself. But make sure, of course, you're consulting your physician and your lactation consultant with any of the issues that we have talked about in this video. And make sure you are educating yourself as well. I highly, highly recommend this book called The Womanly Art of Breastfeeding. I've talked about it in my other breastfeeding videos, but make sure you check out this book. It has helped me so much in my breastfeeding journey. It talks about all of these topics plus 1,000 more, and is even going to go into more detail than I can in this video. I plan to be making more videos about breastfeeding issues and breastfeeding topics. So if you have any questions or any ideas that you would like to see covered in those videos, make sure you let me know in the comments below. And of course, subscribe and hit the like button if you enjoyed this video so I know to keep making content like this. I am the House Hacking Mom. Thank you so much for watching. I like to make videos about frugal living, minimalist parenting, and healthy eating. Thank you so much for watching. Bye.